My name is Melanie Joyner. I'm a community health advocate. I've been with UAMS for a total of 10 years in this position for a year and a half. I work with individuals that are using the emergency room as their primary source of health care. With that, we realize that a lot of the patients are not necessarily coming here for health issues. They're coming here for more social issues. In this position, I'm able to work more with the community and able to help assist them with housing, food resources, employment. I think a lot has to do with culture. In our community, a lot of people have been raised to come to the emergency room whether they can't afford their co-pays to go to their primary care or they don't have a primary care doctor.
I'm Trenda Ray. I am the Associate Vice Chancellor for Patients and Families. I've been at UAMS now for 6 years. I have started working with Melanie about a year ago when I met her through the Care Management Department and through a grant that she was partnering with the College of Public Health and the Emergency Department on. The purpose of the grant at that time was to place a community health worker in the emergency room to work or to partner with familiar faces or those patients who frequent the emergency department for various reasons.
The most common problem that we have is mental health and housing. We also have come into the place where we're hearing where a lot of the different shelters, we found that they can't, when it's time to leave, they can't allow the patients to leave their shelters and just go to the streets. So they want them to go to a safe place. So their alternative is to bring them to the emergency room. So we're kind of trying to help deter some of that.
Not all the patients that they work with are homeless. Some of them have housing insecurity. They may live with family members or friends, but that's not a consistent residence for them. They also have issues with obtaining their medications. They have issues with transportation to their physician appointments. And they intervene in some amazing ways. That's part of why they spend most of their time out in the community. I rarely see them here on campus, honestly, unless they're visiting patients inpatient who are getting ready to go home or the emergency department. But they partner with those community leaders in the shelters. They know the patients, they talk about them, and they follow up on them there as well to see how they're doing. So Melanie not only brings a wonderful personality. She has a very sweet disposition, but she also can say no when she needs to say no, or can give some pushback when that's needed. But she is so approachable and so warm with the patients, which also helps her in her partnerships in the community.
This is one of the most rewarding jobs that I have ever had. It's just to help people. Some of the people, they really don't. They are just really lost. Some of them are hopeless. They just don't know how insurance works. They don't know anything about the medical field. So it's one of the most rewarding jobs, being able to help people to really be concerned about their own health.